Hello everyone. Today in our series of Docplexus KOL interviews, we are honored to have with us Dr. Amarjeet Singh. Dr. Singh is the professor of community medicine at School of Public Health, PGIMER, Chandigarh. Introducing many new concepts like mobile phone based healthcare and multi-purpose behavioral therapy room in OPD, he has played a contributing role in setting the vibe of change and innovation in healthcare. Thank you so much, Dr. Singh, for joining us. So, your idea of mobile phone based healthcare has been listed as an innovative approach in health sector reform option database. So, can you elaborate on this idea?
Actually, it was way back in somewhere around 2002 or 3 when Dr. Surya Bali, who is now in AIMS Bhopal, Associate Professor, he was working as Senior Resident in Narayangarh, which is the field practice area of Community Medicine Department, PGI Chandigarh. So we came up with an idea that mobile phone is a new thing. So gradually it is being accepted everywhere. So many times in rural area, females are not able to go to the hospitals. And they hesitate in telling their problems. And sometimes if they go to hospital, they are told that a doctor is not available. So they have to go back. They have to spend money from to and fro travel. So Dr. Bali and me started this. But the main irony of the situation is that when we floated this idea, and tried to publish our result, we were ridiculed. Okay. And everybody said this is nothing, this cannot be done in medical science, mobile phone. It is sort of opening up Pandora's box. That is the comment we got. Our article was rejected from one journal. So, but we went ahead with that, and Dr. Bali is such a nice person, wonderful person. He stayed with his wife and children in Narayangarh, and from morning till evening he is available on phone. And our results were very encouraging. And many ladies who wanted to talk and they don't want to face the doctor, they talk about their intimate problem on phone. And even after 5 p.m., usually hospital OPD closes at 2 p.m. and ladies may not be free by that time. So whenever they are free, they could talk. So this idea also appealed to people. So from there we started. So we have not left the idea, we are pursuing that.
That is something that young generation of doctors should learn from you, to never give up hope and to continue with their idea and passion. So can you please highlight on your concept of establishing multi-purpose behavior therapy room in the OPD, because that is also a noble concept that you come up with.
Again, I will say the credit goes to my student Mrs. Santosh, who got prestigious President Award from Her Highness Madam Pratibha Devi Singh Ji Patil when she was the President. Actually, we started a project on uterine prolapse. She did MSc thesis on this topic way back in 95-96. So we found that many ladies who have prolapsed uterus, so they keep on tolerating the problem for even 10 years, 15 years, 20 years. And there is a sort of culture of silence and culture of tolerance. Indian ladies, as we know in culture, they are asked to, from the time they start getting periods, that keep on tolerating the pain. Otherwise, how would you bear the pain of childbearing? And they are trained not to tell about their problem to anybody, even their husband. So they keep on suffering. So we realized their problem. So after finishing that thesis in 97, I think 96, 97, 2005 she registered under me for PhD. So our first proposal was rejected. That was on proposal of prevalence of prolapse again, hysterectomy, etc. So that was a blessing in disguise. So next year we submitted another protocol for PhD, some intervention study. So again we found that more than 30% ladies, and that is true for all over the world, they have urine leakage. One out of every third woman, every 3 women, they leak urine somewhere or other, sometime or other. So we found from literature that it is a simple exercise, Kegel exercise, which can be taught to ladies within 5 minutes. And this is very simple exercise. And again, surprising thing is that this Kegel exercise has been there in our Indian culture. That is Mool Bandh and Vajroli Mudra. So experts may speak on that. We started that exercise as a randomized controlled trial and published in International Journal of Obscurity. That is, ladies got relief within 2 months. Believe it. You won't believe it. When we were doing that project, we realized that the ladies in OPD, or not given patient hearing. If you go to any hospital, any department, orthopedic, gynae, hundreds of patients are there. Like Maggi noodles, they do not get more than 2 minutes. Any patient 2 minutes. Within 2 minutes, you cannot teach them anything. And we are talking about health education, etc., empowerment. How can that happen? So we talked with Dr. L.K. Dhaliwal, head of gynae at that time, and Dr. Vanita Suri, Dr. Vanita Jain, A.K. Mandal from urology, and Avinash Rana from nursing. So our team then gave this idea that why not expand this project of urine leakage to the multi-purpose behavior therapy. So the idea is that I am working for last 20 years on demedicalization. Demedicalization is without using medicine, how much relief we can provide to patients. So we found that urine leakage can easily be treated. I am not saying all the cases. Our results showed 80% relief is there. So cases which definitely need surgery are different. But in 80% cases, relief is definite. The results start coming within 2 months. Then similarly, uterine prolapse. If you leave aside the last stage, stage 4 and stage 3B, up to stage 0, 1, 2 and 3A, that is early stage 3, can easily be relieved. The idea is you teach the lady to exercise her perineal muscle, because after childbirth, these muscles get weakened. And constipation should not be there. If there is, we also surprisingly, interestingly found that many ladies who come to gynae OPD, more than 20% has constipation. And naturally, if you have constipation, pressure on abdomen will aggravate the prolapse or leakage. So relief of constipation can be done easily by dietary modification and fluid intake. Ladies usually do not drink much water, because they fear that if they drink water, they will have to go to toilet, and ladies are not sure. So because of that, they don't drink water. When they don't drink water, there is constipation. When there is constipation, there will be prolapse, aggravation or urine leakage. So that is the problem. So we thought that this problem of constipation or training of bladder training cannot be dealt with in crowded OPD. Because in a OPD, there will be 3-4 doctors, 5-6 patients, their attendants. How can you train them? So we gave this idea that a separate room in OPD should be established. The complicated cases should be dealt by the specialist gynae people, and those who don't require any sophisticated or detailed investigation. So after initial workup, after prescription of the OPD card, they should be sent to a separate room where counselors and junior level staff or from community medicine, the team sits there and explain the lady. So we thought that a room should be established, and for last 6 years, we are running that room successfully. So in that room, we are dealing with, say, prolapse, urine leakage. So that gave us an idea, why not propagate that this MTBT, that is multi-purpose behavior therapy room, to all the colleges. So we did that, and we are happy to share with you that Military Hospital Jodhpur and in Ajmer, Dr. Jindal was there, so they knew me, they heard about our project. They invited me and our team to their hospital. So we transported and transplanted this idea and propagated this idea to military hospitals also. And these 2 hospitals are successfully running this similar concept there.
So definitely we think that MPPT rooms should be established in all the units, whether it's public or the private sector, and we hope that this is being done soon. So do you think Docplexus and online professional network can help in raising awareness?
Because your question is quite good, that, and I am happy that Docplexus is thinking about that, because technology is there, but usually technology is not utilized, and in medical science we are lagging far behind. In, say, diagnostic, technology is helping us, but providing direct relief to patients, I think Docplexus has done a humongous job, and it can still further contribute. And it is a good initiative, and I think all the medical fraternity and all the discipline will surely collaborate and coordinate, and definitely will contribute to that. I think this has great future.
Thank you so much, Dr. Singh, for sharing your valuable pearls of wisdom with our members. Thank you. To stay updated on our latest KOL videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!